In this video, I will talk about possible methods to manage meltdowns in public spaces. Children with autism may experience meltdowns in public spaces due to sensory overload, communication difficulties, changes in routine, or other triggers. Managing these meltdowns effectively can help ensure the safety and well-being of the child and those around them. Here are some possible methods to manage meltdowns in public spaces. First, stay calm and patient. As a caregiver or parent, it's crucial to maintain calm and patience during a meltdown. Avoid getting frustrated or angry, as this may escalate the situation further. Remember that the child is already overwhelmed and needs support. Second, identify triggers. Understanding the child's trigger can be beneficial in preventing further meltdowns. Keep a journal or note down the situations that lead to meltdowns and try to avoid or minimize exposure to those triggers when possible. Third, create a safe space. Sometimes simply finding a less crowded corner or a nearby room can make a difference. If you can, move the child to a quieter and less stimulating area to help them feel more secure. For example, if this happens in a crowded mall, move the child to the bathroom or a feeding room. If it happens in a restaurant, choose a corner table away from the rest of the customers or retreat into the bathroom. Fourth, use communication strategies. For nonverbal children or those with limited communication abilities, it is essential to use alternative communication methods such as visual schedules, picture cards, or sign language to understand their needs and feelings better. How would you use that alternative communication? For example, if the child uses a visual binder to communicate, then have the binder with you. If beside binder you are using visual schedule and first and then board, have those with you as well. This will help you understand and communicate with your child. Fifth, give space and time. Allow the child some space and time to process their emotions. Avoid overwhelming them with too many instructions or demands. For example, when the child starts screaming and crying, do not start talking by using too many words or questions. Instead, be present. Try guiding the child to a quiet area. You can redirect the child to calming techniques or sensory toys by engaging with the sensory toys yourself and the child watching. Do not push items, toys, technology on the child when distressed. Take a step back, pull those toys, items out, and play with them in the child's view. When the child will be ready, they will approach you. Then you can offer the child the sensory toy. Let them interact with the toys. Then present the visual schedule and the alternative communication. 6. Provide sensory support. Some children with autism may be sensitive to certain sensory stimuli. Carrying sensory items like fidget toys, noise-canceling headphones, weighted blankets, weighted toys, vibrating pillows, or massager can help provide comfort and regulate sensory input. 7. Redirect attention. Once the child is starting to calm down, redirect their attention to something they enjoy or find calming. This can help shift their focus away from the overwhelming experience. For example, redirect to a sensory toy, a squishy ball, a pop-up toy, or a vibrating massager. 8. Signal transitions. Sudden changes in routine can be distressing for children with autism. Provide warnings or signals before transitions to prepare them for upcoming changes. For example, you can use countdown 3, 2, 1, let's go. 9. Positive reinforcement. Praise and reward the child for their effort in managing challenging situations or for exhibiting positive behaviors. Positive reinforcement can encourage good behavior and coping skills. 10. And last method, practice desensitization. Gradually expose the child to mildly challenging public spaces and situations to build tolerance over time. This process, known as desensitization, can help children adapt to different environments. Remember that every child with autism is unique, and what works for one individual may not work for another. It is essential to observe and understand the child's specific needs and preferences to develop effective strategies for managing meltdowns in public spaces. I hope this video provided you with some possible methods to manage meltdown in public spaces. If you have any questions, make sure you type them in the comments below and I will do my best to get back to you. Thank you for watching. I'll see you in the next video.